program chair for this year's World Congress, will present his work and his team's work on the Cleanscope.
Okay, thank you very much. So is there anybody here who has trouble with a telescope getting smudged from time to time, or blood on it, or stool, or whatever? Well, I think you're going to see that it's probably over. So the problem is that every once in a while, or more than every once in a while, depending on the complexity of the case that you're doing, that the scopes can get dirty from a variety of different ways, either from the smudging when it's going through the trocar, or it hits a piece of balley, gets smudged, or the liver, whatever. It doesn't really make any difference. And that's potentially problematic on multiple levels, not only because of safety of whatever you're doing. I mean, clearly it's better to see than not see, but the loss of direct continuous view of the operating field can be problematic to the patient, can even potentially be dangerous, but for sure, we get annoyed when we can't see what we're really trying to do. And for a gallbladder, straightforward gallbladder, clearly there's not too much issue with the scope. I mean, maybe once or twice. But when I do some of these complex GI revisional type of gastrointestinal stuff, with the trocar that I happen to be using, I won't mention any names, but it's awful. And every time I put the thing through, I have terrible smudge. Not every time, but often. And I can actually have exchanges, we've counted, 40 to 50 times during a case, and that adds an appreciable amount to the procedure. So Cleanscope, catchy name, has developed a patented device. There are actually a couple of patents. One's issued on what's pending on the tip of the laparoscope, and potentially not potentially, it can be on a flexible endoscope as well, to keep the view clearer all the time. It is a rapidly spinning optical disc. It rotates at about 3,000 RPM, that's 50 times a second, and which does not allow anything to adhere to it. And when I say anything, I'm talking about anything. Even epoxy glue doesn't adhere to it. It spins rapidly enough, so rapidly that you can't detect it with the human eye. And even if there was something on the edge of it, or on the optical disc, which there won't be, but even if there was, you wouldn't be able to see it because it's spinning so quickly. There's a little bit of heat that's generated, not so much from the spinning of the disc, but from the type of motor that drives this thing, and that motor is calibrated to be at 37 degrees, so there is no more fogging issue. You don't have to heat your scope or Fred or whatever. I don't think Fred would be a good company if this thing really works, comes out. So at present, it's a prototype right now that's designed to fit as an overtube, but that's not the final design. And the final design is it will actually be incorporated onto the tip of the scope, and I'll show you a little video about that. Easily adaptable. It is going to be, or planned to be, a disposable unit on each tip of the laparoscope. So let me just stop that for a second. What you're going to see is on the left is the scope. It's a 5mm scope with the overtube on it. On the right is the image of the sponge for which the scope is looking at. And this is what's put on the end of this thing now is a betadine type of fluid. So, wrong way. Can I go back? Stop for a sec. Go back to the other slide. I assume when I type, there it goes. Okay, so we see it spray, and look on the right. It just continues. It stays clear. And that's true. That happens to be a betadine solution, but it's true with blood as well. Okay, so I think you got the idea. The next slide I'm going to show you before I start it is they have to play with it a little bit, because when the device is on, it stays clear the whole time. So if I just show you a video with whatever they're doing, whether this happens, you'll see some blood from a liver gallbladder and touching the liver and stuff, you'll see a smudge on it. The only reason there's a smudge on it because the device has been turned off. And what you'll see is that when they turn the device on, that the image clears instantly. When it looks like it's clear, a switch has been made to keep it on. Otherwise, you wouldn't be able to tell that there's a smudge because there's no smudge. Next slide. Can you advance the next slide for me, please? Thank you. Okay, so this is pig gallbladder, and you're just putting it in there to purposely make a smudge on it, so it's smudged, and they don't take, and then you see it clears. They push the button so it's clear, and they'll do it again. stick it right in the middle of blood and bile, and you'll see a smudge on the end of it. There must be a laser pointer. Oh, here it is. You'll see. And then they hit the switch. Right now there's a switch. There won't be a switch on it. Smudge. Clear. So the disc, once they turn the disc on, it totally clears it. Here's another little bit better demonstration maybe. This is touching the liver. Turned off. You'll see a smudge. Here's a smudge. They'll flip the switch. Now, clear. So the motor on this thing, I'm not the inventor is here, and if somebody has some technical issues they want to discuss, it's over my head. But here you'll see smudge, clear. If you ran the disc all the time, you wouldn't see that because it just stays clear. I don't know why I won't run the next slide. Next slide, please. You flip the next slide for me. So this is a schematic of the way it's planned to be designed. I'll stop it right here. This is a standard telescope. This telescope could be either 3 millimeters to 3 millimeters, 5 millimeters, 10 millimeters. It doesn't make any difference. The tip will have to be a change in the design so that will allow this, which is the Cleanscope device, the disposable device, to actually clip onto the telescope. I'll do that. And I'll stop it there for a second. Pay attention to these little prongs here. This will click into the scope. The design is that it will click into the telescope. The light, you'll see the light come on as it clicks on, and it's because the light has been directed to an upward position so that the disc is in the middle of the optics. And then once it's connected, the light will come on. So disposable device, in order to remove this thing, there's a device, instrument that actually sort of crushes those clamps and pulls it off. So when that happens, it breaks the connection between the endoscope and the device, so it can be used only once. The power of this now is about to work at about 4 hours of use, and then it has to be replaced. So in conclusion, it's possible to have a clear field at all time, and that includes blood. If you get bleeding, blood comes on this thing, it's clear. There's no blood in the way, so you can take care of whatever is bleeding because you can see. I think the instance of surgical trauma of the tissues will be secondary to inadequate visualization will be gone. Theoretically, that will decrease conversion to open. I say theoretically because, once again, and it's a lot of things that end up being trauma to tissue. Clearly, the operative time is going to be a lot less, especially for advanced procedures. And I think our frustration with not having a clear image is over. And I'll be glad to answer any questions you have.